Good evening, everyone. I welcome each one of you for the new session of Polaris Talks today. As we all know, from this week onwards, we will be coming live every Mondays and Fridays, sharp at 6:30 p.m. So, as promised, we have come up with the next session in general anatomy, which is actually the continuation or part two of joints, where our dear Dr. Ryan Fernandez will be taking out the synovial joints in detail. So, for that, I welcome our dear Ryan, sir. Hi, sir. How are you?
Hi, Aishwarya. Thank you. I'm fine.
Okay, all right. So, sir, I'll not waste much of the time. Let's slowly peep into the synovial joints in detail, sir.
Yes.
All
So,
right. Thank you.
good evening, everyone. We began a bit of joints in the previous session, and we'll brush through what was taught last time, and we'll also learn something new today. So, first, coming to joints. Whenever we talk about joints, we need to remember that there are two types of joints: synovial joints and solid joints. So, as you know, joints are the areas where two skeletal elements meet each other, where they come together. And there are two types of joints where you can see in the picture, there synovial joints as well as solid joints. Now, very, very important to understand the concepts of these two, that is synovial joints as well as solid joints. So first, coming to the synovial joint, you can see that from the image itself, they look like two completely different entities, but both of them are joints. So first we'll discuss about synovial joints, the upper one. So remember the features of synovial joints now. So it has a narrow articular cavity. There is a layer of hyaline cartilage. It has joint capsule, and there can be bursae as well as tendon sheath. So now look at the upper image. So this is one bone and this is one bone. So the first point that we said is there is a narrow articular cavity. So the point where the two bones meet, there is a cavity that is there, and that is known as the articular cavity. So that is one feature of synovial joint. The other feature of synovial joints is that these bones don't come in contact with each other directly, because if they do, two bones will grate against each other and cause friction. That is why they have a coating. And what coating is this? This is a coating of hyaline cartilage. Hyaline, when we spoke about hyaline cartilage in the chapter of cartilage, we spoke about how hyaline is derived from the term hyalose, which means transparent. So this transparent cartilage is covering the bones on both the sides, so that the bones directly do not come in contact with each other and they don't produce friction. So hyaline cartilage that covers the bones, they avoid friction that is there between the two bones, and it allows for the smooth gliding of one bone over the other. We also spoke about a joint capsule. Now the joint capsule is composed of two layers. That is the inner layer as well as the outer layer. Now the inner layer is called as the synovial membrane, the pink one, and the outer layer is called as the fibrous membrane. Now the inner layer, that is the synovial layer, the synovial membrane, secretes fluid, and this fluid is secreted into the joint cavity, into the articular cavity, and that is why this articular cavity is filled with fluid. And this fluid not only avoids friction along with the hyaline cartilage, it avoids friction between the two bones, it also nourishes the cartilage and provides nutrition to the cartilage. So that is the function of the synovial membrane. The synovial membrane, if you see from this pictorial representation itself, you can make out that the inner synovial membrane starts at the junction between the bone and the cartilage of one side and goes up to the bone and cartilage of the other side. That is the inner layer, the synovial membrane. It secretes fluid which not only nourishes the cartilage, it also helps to reduce friction between the two bones. The outer layer is covered by a layer known as fibrous membrane, and this fibrous membrane gives strength to the joint. It holds the joint together, and that itself gets thickened to form what is known as ligaments. So these are the different parts of the joint capsule. Now there was one last point that was mentioned in the when we spoke about the joints, and that is the bursae and the tendon sheath. So narrow articular cavity, we know what it is. What is layer of hyaline cartilage? We know. Joint capsule, we know the inner synovial membrane, outer fibrous membrane, bursae and tendon sheath. Now, what are these bursae and tendon sheath? We said that the synovial membrane secretes fluid into the joint cavity, into the articular surface. So that fluid remains within the capsule of the joint. Now, if this synovial membrane secretes fluid outside into another cavity, it gets filled like a air-filled balloon, a water-filled balloon between the bones and the skin, and they are known as bursae. And that those bursae prevent the friction between the skin and the bones. It helps for it acts like an extra cushion. So when the synovial fluid is secreted outside the capsule, which is covered completely, I'll show you in the next image, which reduces the friction between the bones and the skin, then it is known as the bursae. So these are the important points that are related to synovial joints per se. There can be some additional structures that can be present in synovial joints. These are additional structures. They need not be there in every synovial joint. They can or may not be there. So first one is articular disc, second one is fat pad, and third one is tendons. So articular discs are this shaped cartilage. Here the cartilage is made up of fibrocartilage. The cartilage that covers the bone is the hyaline cartilage, but these articular discs, when they are present, they are made up of fibrocartilage, and their function is that it is present around the corners of the joint. So this is hyaline cartilage. So the articular cartilage will be here somewhere in the corner, and one is it helps in absorbing the compressive forces that can occur at the joint, and the second one is it helps in the free movement of the joints at the angles. Second one is fat pads. These fat pads are present between the two layers of the joint capsule. Now, the two layers of the joint capsule, you know, are the inner synovial membrane and the outer fibrous membrane. These fat pads are present between the inner synovial and the outer fibrous membrane, and these fat pads keep moving in and out of the joint capsule, and thereby again they help in protecting the joints and avoid friction. And of course, tendons are present. Now this will make it all very simple. So now you can see there is a bone here, there is a bone on this side. There is a layer of hyaline cartilage on one bone. There is a layer of hyaline cartilage on the other bone. Both the hyaline cartilages meet, and there is a cavity between the two, and that is the nothing but the articular cavity. The two layers of the joint capsule are the inner synovial membrane, which extends from the junction of the bone and cartilage on one side to the bone and cartilage on the other side, and the outer fibrous membrane, which gets thickened. These together are known as the joint capsule. We know that this inner synovial membrane secretes fluid into the capsule, and the hyaline cartilage, along with the fluid in the articular cavity, they help in the nourishment of the joint as well as reduce the friction. Then we come to the additional structures. Now you saw that there is a bone here, there is a bone here, cartilage here, and there is hyaline cartilage here. You can see this hyaline cartilage is different from this cartilage, what is known as the articular disc. You can see like a disc-shaped structure, triangular structure here, and one triangular structure on the lower end, and they are known as articular discs. They are made up of fibrocartilage. They help in absorbing the compressive forces that occur on the joint, and they help in the movement of the joint as well. Then you can see one fat pad here. I told you the fat pad is found between the synovial membrane, that is the inner synovial membrane, and outer fibrous membrane. And this fat pad can go into the joint and come out, and thereby provide additional cushioning to the joint. When the synovial fluid is secreted outside the joint capsule, they form what is known as bursa. And these bursae are usually found between the skin and the joints, and they provide cushioning to the joints from outer surface. They provide here the cushioning is between to avoid friction between the joints. Here the cushioning is from the exterior. For example, when you're kneeling down, you don't want the the joint to come in direct contact with the ground just with a thin layer of skin, the protection is given by bursa. And thickened sheath there is known as the tendon along again, which gives strength to the joint. So all these are the different components of a synovial joint. So again, to see these bursae are also important. Just to tell you the importance of bursa, this is the space, the articular space. The bursa is here, which is known as the prepatellar bursa, the bursa in front of the patella. Then there is one more bursa here lower down. All these bursae help to avoid friction. And later you will know that there is a condition called as bursitis, where the fluid, the synovial fluid within this bursa gets infected, causing inflammation, pain for the patient at these joint areas, and then it is known as bursitis. So anytime you see an X-ray in future, you will realize that there is a gap between the bone. The bones are not freely away from each other as much as it is seen on an X-ray. Why is the gap? Yes, the common answer is there is a cavity. But the reason for the gap is not just the cavity, because the cavity is very, very little, very small cavity. The reason the two bones look like they are far away from each other is because they have a transparent cartilage, what is known as hyaline cartilage on each side. So there is no gap here. There is actually hyaline cartilage. It's just that you can't see it on an X-ray. There is no gap between this bone and this bone. There is hyaline cartilage in between. So that is why on X-rays, bone look like they're floating freely. Next, we come to the classification of synovial joints. Remember, now we are still talking about synovial joints. Solid joints were already discussed. We'll brush through those as well. Now, synovial joints are classified based on their structure as well as function. Structure, that is based on the shape of the articular surface. Remember, there are based on the shape of the two surfaces which are meeting each other. This is just based on shape. They can be divided into plane joints, hinged joints, pivot joints, ellipsoid joints, saddle joint, and ball and socket joint. Again, I'm reminding you, this classification of synovial joints is based on the shape of the articular surface. So in a plane joint, the two flat, it is a type of joint where two flat surfaces come in contact with each other. So that is known as a plane joint. That is the acromioclavicular joint. So acromioclavicular joint is a typical example of a plane joint. The movement here occurs only in one axis. Remember, the in plane joint and hinge joint, the movement occurs only in one axis. So plane joint, example is acromioclavicular joint. Second one is hinge joint. This is easy to understand. All doors have hinges. When you open the door and close the door, that is the hinge joint. That is the same movement that occurs in these joints. So you can see the movement occurs in a plane transverse to the joint. So this is the joint. The movement occurs in this plane that is transverse to the joint. The typical example of a hinge joint is nothing but an elbow joint. You can see in this picture. So in a plane joint and hinge joint, movement occurs in one direction, in one plane. Then come the pivot joint and ellipsoid, pivot, ellipsoid, and saddle joint. A pivot and ellipsoid joint where the movement occurs in two perpendicular planes. So pivot joint, obviously you know the word pivot. You can turn from one end to the other. That is, look from one side to the other. That is the atlantoaxial joint here in the spine. So that is known as the one example of pivot joint. Then comes ellipsoid joint. Now this ellipsoid joint, forget about this red mark that is shown here. That is actually for the next one. The ellipsoid joint, the typical example of an ellipsoid joint is the wrist joint. So here what happens is movement takes place in two planes. I told you in pivot joint and in ellipsoid joint, movement occurs in two planes perpendicular to each other. So upwards and downwards and sideways. So that is the movement that is seen in an ellipsoid joint. Then comes the saddle joint. So saddle joint is nothing. Again, we are talking based on the shape. Saddle joint is nothing but a rider sitting on the horse. So it is the rider, the two legs on either side of the horse, and that is known as the saddle joint. The seat on which the rider sits on a horse is known as a saddle. So the typical example of a saddle joint, so you can see this is the rider is sitting on the horse. So that is why it is known as the saddle joint. The typical example is that of your thumb. That is a metacarpophalangeal joint, and that is an example of saddle joint, and it has movement in all the direction. And the last one is ball and socket joint. This you will know that it is the best example for a ball and socket joint is that of the shoulder or the hip joint. Here the movements are possible in all the axes. So based on the shape of the articular surface, based on the shape of the 2 points which are coming in contact, the joints are divided into plane joint, hinge joint. Both are uniaxial movement only in one plane. Then comes pivot joint and ellipsoid joint, where movement occurs in 2 planes perpendicular to each other. And the third one, last two are saddle joint and ball and socket joint, which has movement in all the planes. So that is basic. So again, to give you an example so that you understand better. So first joint, and this wrist joint is an example of condylar joint, also known as ellipsoid joint. I told you movement in 2 planes. At that wrist joint itself, you can see that there is a gliding joint, that is radio-ulnar joint. Gliding joint is the other name for plane joint because it helps the 2 bones to glide against one another. So this the wrist joint is an example of ellipsoid joint. The radio-ulnar joint is an example of gliding joint, which is nothing but a plane joint. Third one is elbow hinge joint. Again, just remember the hinge of a door, easy to remember. D is the hip bone. So this is a ball and this is the socket. The ball goes into the socket, so ball and socket joint. This is the saddle joint. So the carpometacarpal joint of the thumb. So this is the rider going and sitting on the horse, and it allows movement in all the axes. And the last one is pivot joint, that is the atlantoaxial joint. So those were how the joints were divided, the synovial joints were divided based on the shape of the articular surface. Next, you come to the joints based on the movement. So it can be uniaxial, biaxial, and multiaxial. Again, from the name itself, you know that uniaxial is movement only in one plane. Biaxial, that is, there is movement in 2 planes, and multiaxial, there is movement in 3 planes. So that is about the synovial joint. That's all about synovial joint that you should know that we have completed. Next, we come to solid joint. This was already discussed, but I'll briefly go through it as well. So now you know joints are broadly classified into synovial joints and solid joints. Synovial joints are classified. Synovial joints have their articular surface, hyaline cartilage, joint capsule, bursae, and tendon sheath with additional structures of articular disc, fat pads, and tendon. They are classified based on the shape of their articular surface and also based on the movement. Now coming to solid joints. Solid joints are connections between skeletal elements where the adjacent surfaces are linked together by fibrous connective tissue, cartilage, usually fibrocartilage. There are two types of solid joints, that is fibrous joints and cartilaginous joints. I'll show you cartilaginous joints later. So remember, solid joints, they don't have any synovial fluid, they don't have any articular cavity. They are linked together by fibrous connective tissue, by cartilage, and that is usually fibrocartilage. Solid joints are further divided into fibrous joints and cartilaginous joints. First, we'll come to fibrous joints. They are further divided into sutures, gomphosis, and syndosmosis. So first one, coming to sutures. Sutures are nothing but joints of the skull where the 2 plates of the skull are joined together by connective tissue, and that is known as sutural ligament. So that is sutures. Simple. So fibrous tissue, fibrous connective tissue is connecting the 2 plates of the skull at the suture. Second one is gomphosis. Here the tooth comes in contact with the bone, the jaw bone, and there is a ligament, the periodontal ligament that separates the 2. So gomphosis are seen in the teeth. And syndosmosis are those joints where the 2 bones are linked together by an interosseous membrane. The typical example is that of a radio-ulnar joint. So solid joints, they are further divided into fibrous and cartilaginous. Fibrous is further divided into sutures, gomphosis, and syndosmosis. Sutures are seen in the skull. Gomphosis are seen in the teeth. Syndosmosis, the example, one of the examples is the radio-ulnar joint, which is separated by an interosseous membrane. Now we come to each one. So sutures are further divided into plain sutures, serrated sutures, squamous sutures, denticulate sutures, and Syndosmosis. So it might be sound very traumatic, in fact, to read all this. So now we came to from the joints, we came to synovial joints and solid joints. In that, we have come to solid joints now. In solid joints, we have divided into further fibrous joints as well as cartilaginous joint. In cartilaginous joint, in fibrous joint, we have further divided into the sutures, gomphosis, and syndosmosis. In sutures, we have further divided into plain, serrate, squamous, denticulate, and Syndosmosis. Now, what are each of this? So first coming to plain sutures. It is very simple. Just keep the pictures in mind. You will never forget. So first coming to plain sutures, the two bones are joined together by a linear suture. This was, I'm sure, taught in the last class. I'm just brushing through again. So bone to bone linear suture. Squamous suture, there is a oblique line. Serrated sutures, there is serration. And denticulate suture, denticulate like teeth. So it is like as if one tooth has gone into the other. So that is denticulate suture. So, and last one is Syndosmosis. Remember, the moment you think of Syndosmosis, remember there is a groove that is going into the ridge, a ridge going into the groove. This is the ridge, and the ridge is going into a groove. So these are the different types of suture joints that you can see. So again, plain suture, squamous suture, denticulate suture, serrate suture, and Syndosmosis. Let's see the example for each. Plain suture, so interpalatine suture or even palato-maxillary suture, they are the typical example of plain suture, almost a straight line between the two bone plates. Then comes denticulate suture. The lambdoid suture in the skull, you can see it looks almost like multiple teeth there. So that is why the name denticulate. So denticulate suture. Then comes sagittal, the simplest one that you can see, the sagittal suture in the skull. That is the example of serrated suture. And the rostrum of the sphenoid, the ala of the vomer. So the ridge going into the groove going, ridge going into the groove. So that is Syndosmosis. So these are the two, these are the different sutures that you have to remember. The squamous suture that is seen at the squamoparietal suture. Then coming to syndosmosis, where a fibrous joint, it is a fibrous joint in which two adjacent bones are linked together by a strong membrane. Example is interosseous membrane, talofibular, and ligamentum flavum. So ligamentum flavum is the ligament which joins two vertebral lamina together. So there it is nothing but a ligament. And last one coming to gomphosis. I told you it is seen in the teeth, a type of fibrous immovable joint such between the teeth and the alveolar bone. Then the solid joints are divided into cartilaginous joint, which are further divided into synchondrosis and symphysis. Synchondrosis are those joints that are seen in a developing bone, in a young bone, in a bone which is growing. So you can see here that there is a head and the shaft of the bone, and in between that there is a growth plate, also known as epiphyseal plate. The cartilage here, there's a cartilage here, and this is known as synchondrosis. This is very, very important for the growth of the bone. If this gets destroyed during development, then that bone will not grow. And these joints are known as synchondrosis, which is nothing but the epiphyseal plate. Symphysis are the cartilages that are found joining two bones together, and these are usually seen in the midline. For example, pubic symphysis and the intervertebral disc. So these cartilaginous joints are further divided into primary cartilaginous and synchondrous joints, that is immobile, temporary, hyaline cartilage ossifies after some time. First costochondral joint, epiphyseal plate. So you can see here the epiphysis, the diaphysis, the head and the shaft, and the cartilage in between the two, that is the growth plate. So this is one. And the second one is manubrium and the costal cartilage, that is the hyaline cartilage. Then comes secondary cartilaginous joints, that is the symphysis. So this was synchondrosis, and these are the symphysis. These are slightly mobile, permanent. Hyaline cartilage is present with fibrocartilage in between, seen at the pubic symphysis, intervertebral disc, and manubrium-sternal joint. So these are the examples of symphysis. I told you it is seen in the midline. So manubrium-sternal joint, pubic symphysis, and intervertebral disc, all seen in the midline. And these are the example of symphysis. Last one, so far we spoke about the structural classification of joints. Remember that there is a functional classification of joints. They are called as synarthrosis, amphiarthrosis, diarthrosis. Very simple. Synarthrosis, no mobility of the joint. For example, the sutures of the skull, they are not going to move, so they are known as synarthrosis. Then coming to amphiarthrosis, where it is slightly mobile. Example is intervertebral disc. And diarthrosis, freely mobile joints, and that is synovial joints. So again, functional classification is divided into synarthrosis, amphiarthrosis, diarthrosis. Synarthrosis, where there is no mobility. Amphiarthrosis, where there is slight mobile joints like the intervertebral disc, and diarthrosis, freely mobile synovial joints. So with that, we come to the end of the topic on joints, and we will also move on to the questions. Some of the questions were discussed in the last class, but we'll still, the audience is different, so we'll still go through the questions. I would also like to bring in Aishwarya here.
Yes, sir.
So the first question, a newborn child was noticed to have an asymmetrical head. He was diagnosed with craniosynostosis and was advised surgical correction. Can anyone identify, as per the structural and functional classification, which type of joints are affected? Remember, structural and functional.
Anyone who wants to answer can post your answer in the comment section.
So I want the structural as well as functional classification.
Try answering. It's going to be very cool. No worries on that. Yes, we have someone. Okay, sir, I think the screen share is stopped. Can you show them the screen?
Yeah, I'm trying.
You can read the question again.
A newborn child was noticed to have an asymmetrical head. He was diagnosed with craniosynostosis and was advised surgical correction. Can anyone identify the structural and functional classification of which type of joint it is? So here I will want, I told you from the beginning, the classification, go in an order what it is. Don't just give me one word answer.
So we have Ahmad, who has answered as amphiarthrosis and fibrous.
Yes, we can have him, if he can explain, come online, switch on his mic.
Can you unmute yourself, please? Hello?
Anybody else wants to attempt on the mic?
Anyone else who wants to try answering, please, you can either post it in the comment section or even unmute yourself and answer. Are you able to unmute yourself, Shenwaj? Yeah, we have someone else. By
Yes, Biplab, can you switch on your mic?
Can you unmute yourself so that we can have a small discussion?
Yes, ma'am.
Hi. How
Who
do
is
I
this?
name?
Yes, ma'am.
Can you say me how do I pronounce your name?
Biplav Prushti.
Okay, okay. Hi, Biplav. How are you?
Fine, ma'am.
Where are you from?
Odisha.
Odisha. Okay, okay.
Very good, Biplab. You got the answer right. So, according to you, it's a fibrous joint. So, if we go in the order, when we classify joints, we said there are two types: synovial joint as well as solid joint. So, first thing is it is a solid joint, correct?
Yes, sir.
Then, in solid joints, we further divide them into fibrous and cartilaginous. So, you said it is fibrous joint. Very good. Now, in fibrous, we further divide it into sutures, gomphosis, sutures, gomphosis, and syndosmosis. In sutures, we further divide it into serrated, plain, squamous, and shindialysis and denticulate. So now, can you tell me the complete classification? If I ask you now what kind of structural joint it is, can you give me the full classification?
Sir, denticulate.
No, you are right. It's start with solid joint. Solid joint.
Yes.
Okay. Then it becomes fibrous joint. In fibrous, it is suture. And in
Yes, sir.
suture, it is what Shanawaz has said there, serrated. So that is how you understand the concept of joints, make it very simple for yourself. And functional, we said there are three types of functional joints. What are they? Synarthrosis, where there is no movement. Amphiarthrosis, where there is slight movement. And diarthrosis, where it is freely mobile. So the sutures will obviously not move. So it is synarthrosis. So good, Biplab. We'll go to the next question. A 22-year-old male came to the OPD with complaints of non-healing socket in the right lower alveolus since 1 month. He gave history of tooth extraction for caries 1 month back. Can you identify what structural classification of joint is this? So tooth is come for tooth extraction. The tooth will be removed. So what joint is all this concerned with? Harshita says gomphosis.
Yes.
So
anyone else who would like to answer, or do we want Harshita in the mic, sir?
yes, Harshita, come unmute and tell me the entire classification of this. Good, the answer is right.
Harshita, can you please have you on the mic, dear? Hello.
Yes.
Hi,
Good
Harshita.
evening, ma'am. Yes, good evening, ma'am.
Good evening, dear. Where are you from?
Ma'am, I'm from Jamshedpur.
Okay. How are you doing otherwise?
I'm absolutely fine.
Great to know that. So, can you just answer to sir?
So Harshita, you are right. Can you give me the full classification?
Yes, sir. Sir, these gomphosis are the peg and socket type of joint, and these are like found in the teeth and alveolar sockets. So, like these are the specialized fibrous joints.
Very
So,
good. And fibrous joints are a part of
fibrous joints,
solid or synovial?
it's a solid.
Solid. So now when you're talking about this, to make it very simple for you, it is a solid joint, and in solid joint, it is a fibrous joint, and in fibrous joint, it is a gomphosis. If I ask you what is the functional type of joint here,
Sorry, sir.
what type of functional classification does this belong to?
The functional classification.
Yeah, of this joint, what functionally is it? Again, I go back to this. Is it synarthrosis, amphiarthrosis, diarthrosis? You told me based on the structure. So is there mobility? Is there slight mobility? Is it freely mobile?
Sir, there is no mobility.
So it is synarthrosis or synarthrosis. Very good. So that is how you think. Everything you classify like that, it becomes very easy. Okay, Harshita, thank you.
Thank you.
So
sir.
we go to the next question. A 52-year-old male came to the OPD with complaints of severe lower back ache, which aggravated after lifting a heavy bucket. An MRI confirmed intervertebral disc prolapse with significant herniation. Can you identify the structural and functional type of joint affected here? I want the structure as well as function. Again, I'm reminding you, functional is synarthrosis, amphiarthrosis, diarthrosis.
Anyone who would like to answer?
So whenever a question is asked, think on joints, think whether it is a synovial joint and solid joint. If it is synovial joint, based on what type of joint it is, based on the structure as well as function. Then you think of solid joint, what kind of joint is this, based on structure and function. So Shanavas is answering a lot of questions. I think we should give him a chance. Come,
Yeah.
Shanavas, switch on your mic and talk to us. Good.
He's
The answer
also
is right.
one of our first students, sir. Initial days, I used to see him regularly.
Yes, and he's answering right.
Hi.
Yes, sir. Yes, sir.
Yes, Shanavas. Really good. I really like your enthusiasm. Keep it up. So your answer is right. So can you give me from the top classification of
It is a solid joint, then it is classified
solid
in
joint? In solid joint, it is
cartilaginous.
very good because there is cartilage between the disc, between the intervertebral disc, and in that cartilaginous joints, it is a
Symphysis.
symphysis. Why do you say it is symphysis?
Because it is in the midline.
Usually seen, all these symphysis are seen in the midline. And why did you say it is amphiarthrosis?
Because it is slightly movable. We can move
Perfect answer, 100 out of 100. Good, Shanavas. That is how you, every time I'm telling you, don't think directly in terms of the last one. Start from solid joint, keep dividing it. Start from synovial joint, then you keep dividing. Very good. So we move on to the next one. A 20-year-old male came to the OPD with complaints of difficulty in breathing from the right nostril. He gave a history of road traffic accident 2 months back, post which he developed a deviated nose and difficulty in breathing. During the surgery, the surgeon noticed a broken vomer and rostrum of the sphenoid. Can anyone identify what structural classification this joint belongs to? I told you, just by seeing this, you should be able to tell. There is a ridge which is going into the groove.
Anyone who would like to answer?
I would be happy if you give the classification from the top this time.
We have Shanavas answering.
Yes, I want the whole thing. I told you, start it from the solid joint.
Yeah, can you please frame your answer in such a way which sir is asking from the beginning, starting from synovial or solid to the end? You can try again, Harshita, Shanavas. And anyone else who would like to answer?
Yes, Shanava says solid fibrous sutures shindialysis. Perfect. Again, full marks. So it is a solid joint. In solid joint, it is a fibrous type of joint. In fibrous, it is sutures. In sutures, the ridge goes into the groove, and that is why you say it is shindialysis. Very good. We move on to the next case scenario. In order to perform this particular function, that is pronation and supination, what variety of joint are we going to utilize?
Anyone can answer.
Yeah.
This is a chance for you all to find out. Even if you go wrong, it's okay, because that is how you learn things. It's perfectly fine.
So for those who are coming here for the first time, if you have if you don't know, we allow this forum for open discussion. It's not like a didactic lecture in classroom where you listen, somebody else talks. So there are two things that you should know. We are moving away from the concept of teaching of sage on the stage to guide by the side. So now we are all moving to that form of teaching, which is just guiding by the side rather than sage on the stage. So come on. What variety of joint are we going to utilize here? Solid joint or synovial joint? First point. Remember, we spoke about wrist joint, movement in two planes.
If you guys are feeling like scared or upset not to answer, please keep it aside. This is a very friendly stage. Like sir told, you can actually put up whatever you feel is the answer. And in case it's wrong also, we'll have a discussion on that. We should know why you went wrong there, right? So let us have that discussion. Anyone can answer. Come on, guys.
Okay, so for this one, I will give the answer. The answer here is a synovial joint. Remember, we spoke about wrist joint being a syno. Yes, very good. Harshita has told the answer. Before I told, she answered. It's synovial joint and it's an ellipsoid joint based on the, very good. So Harshita is answering faster than me. So yes, Harshita, both the answers are right. It's a solid synovial joint and it's an ellipsoid joint. We'll move on to the next one because it's similar to the question that I previously asked. A 12-year-old male came to the OPD with complaints of severe pain in the right lower arm since 2 hours post history of fall. An X-ray confirmed fracture involving the lower aspect of the radius. The doctor advised surgical plating and explained surgical importance of this region as he was in his growing years. Can anyone identify, as per structural classification, which type of joint is affected?
Anyone who would like to answer the question?
You have to really think. Shahnawaz, I will clear your doubt along with this question itself. Don't worry. So now it's a 12-year-old boy. He has developed a fracture here. You can see one fracture line here. Can anyone identify? This is the radius, by the way. This is the metacarpal joints. Can anyone identify the structural classification of this joint? First is it synovial or solid? And then based on that, what it is. So, Shahnawaz says synovial pivot. Yes, I expected that answer. Anyone else wants to give it a try? So the previous one, synovial joint, yes, that is for that action. Now here, when we discussed about the joints, we spoke about, we'll go to that so that there is no doubt. So we spoke about the cartilaginous joint. And in cartilaginous joint, we spoke about synchondrosis. What was synchondrosis? So we spoke about growth plate in a developing bone between the epiphysis and the diaphysis. Between the head and the shaft of the bone, there is cartilage, and this cartilage is known as the growth plate, or the area where the growth of the bone takes place. And that is known as synchondrosis. So the joint here, you can see the clue is that it's a 12-year-old boy, so growing bone. You can see that the fracture has gone right through that growth plate. So the structural classification here is solid joint. In solid joint, it is not fibrous, it is cartilaginous. In cartilaginous, it is synchondrosis, since it is going through the growth plate. Biplab is right, solid, cartilaginous, synchondrosis. Very good. So next we move on to case scenario 7. A 62-year-old male came to the emergency with severe chest pain and palpitation. Angiogram revealed a triple vessel disease, and the patient was planned for cardiopulmonary bypass surgery. During the surgery, the sternum was split in the midline for exposure of heart and vessels. Can anyone identify what structural classification of this joint which was cut it belongs to? Sternum was cut. You can't reach the heart without cutting the sternum. So when you're talking about sternum, you have to cut the manubrium as well. So manubrio-sternal joint. I'm giving you a clue.
Exactly. Anyone who would like to answer? Come on.
Is it a solid joint or a synovial joint? If it's synovial joint, based on classification, is it pivot, hinge, ellipsoid, ball or socket? If it is solid, is it fibrous or cartilaginous? So Shanawaz says cartilaginous. So in other words, it's a solid joint. It is cartilaginous. In cartilaginous, we know that there are synchondrosis and symphysis.
Solid
So it is
also.
seen in the midline. So yes, Shanawaz, correct. It is solid. It is cartilaginous. Give me one more word and the answer is complete. Harshita, if it is solid joint, it is cartilaginous, then synchondrosis. Synchondrosis is seen in the growth plate. Clue here, 62-year-old man. 62-year-old man is not going to grow again, hopefully.
I think it was a typo error. She corrected to cartilaginous.
No, correct. Solid, cartilaginous, and the next word, not synchondrosis. Synchondrosis again in the growing cartilage. You have to remember only two things: growing bone, not growing bone. Young patient, old patient. So now in the previous case, it was a 12-year-old growing boy. So there is a chance of synchondrosis. Here it is 62-year-old male, and it is seen in the midline. So it is solid, cartilaginous, and symphysis. Good. So that is how you analyze. Every question will make you understand better. So next we go on to a 65-year-old male presented to the OPD with symptoms of dull aching pain in his right elbow since 2 months. He also complained that it increases while performing activities and during movement. His X-ray revealed degenerative changes in the right elbow joint, and a diagnosis of osteoarthritis of elbow joint is confirmed. Can anyone identify the structural classification as well as what range of movements will be affected? So now you are understanding the whole point of studying this joints chapter. Later on, you have to diagnose diseases and explain to the patient what kind of movements will be affected. So now here in the elbow joint, something has happened. Now he can't move. Osteoarthritis, usually a disease associated with old age. Old age is not a cause, it is associated with old age. What is the structural classification and what range of movements will be affected? Synovial or solid?
Anyone
Synovial joint, hinge joint. Excellent, Harshita. Synovial joint, hinge joint. What range of movements do you think will be affected? What are the movements that take place in the elbow joint? Uniaxial movement. Yeah, exactly. What movement am I doing now? Abduction, adduction at the elbow joint. Flexion, extension. Yes, Biplav, you're right. Flexion, extension movement is affected. Now that is a structural. We'll come back to functional. What functional classification does this joint belong to? Synarthrosis, amphiarthrosis, diarthrosis. Synarthrosis, no movement. So definitely not synarthrosis. Diarthrosis, yes, free movement is there at the elbow joint. So you can say it is diarthrosis. Good. So now you yourselves are coming out with the answers as the questions are going on. Good. The last case scenario. Can anyone identify the structural and functional classification of the xiphisternum joint? Structural first and then give me functional.
It's clearly marked, yes.
Yes. So Shanavas says, Shanavas always start with solid joint. So that it is easy for you to remember. It's a solid joint. In solid joint, it is cartilaginous. In cartilaginous, it is seen in the midline. It is symphysis, and this joint hardly moves. So you can say that it is synarthrosis, just like how you have answered. So it is solid, cartilaginous, symphysis, and functional is synarthrosis. So with this, we come to the end of the lecture on joints. I hope we could shed some light and make you understand joints better than what you already knew it. Like you saw, it is not, if you structure it properly, it is easier to understand. That's why I keep telling you, start from solid joint, start from synovial joint. It makes it very easy for you to understand rather than just by heart somewhere in the middle and say it is synarthrosis or synchondrosis. So keep reading, and we'll be there as you're reading to shed some light on some of the aspects of your anatomy. I now hand it over to Aishwarya again.
Thank you so much, sir, for such a brilliant session. And Harshita is also joining hands.
Thank you, Harshita. There is nothing more satisfying than a student saying that the class was good and he or she understood. That is the biggest compliment ever you can give your teacher. I hope that we from Dr. Polaris continue this and continue helping you guys understand the topic better.
Yes, I would like to add one more thing because like you guys, when you start appearing for your competitive exams like NEET, PG, USMLE, PLAB or whatever it is in future, why sir is saying to start from solid or synovial is because you will never go wrong with that. By chance you start at the lowest one, there are chances that you will spend a lot of time in one question. At the same time, there are chances when you see multiple options, you'll be confused. You will go wrong sometimes. So if you start from the base, it's never going to be going wrong with you guys. So always remember that. Keep that flow in your mind. It's all about a trial and error.
Yeah, and understand it. See, now when you understand each word of that classification, it becomes so easy for you. People will tell you by heart. That is not the way to go about it. Once you understand, now in the beginning, first 2 or 3 questions, probably there was a confusion. By the time we reached the 10th question, you all became masters and you all were answering. That is because you all understood it rather than you just mugged up or by-hearted the words. That's all.
Exactly. So that the difference, the progression was also very visible, and we were also happy to see that you guys are actually understanding more. So keep doing MCQs or keep doing questions like this so that whatever you learn, you apply it then and there. That makes the whole difference. Writing the exam, yes, definitely it's a part. But above that, applying what you learned is very important, especially when you are in first year. So hope this session was really good. And thank you so much, everyone, for listening. And we had Harshita, Shanwaz, and Biplab who have been answering for almost all the questions.
I think
Especially
we should, wait, Aishwarya, I think we should like take each one's name who has Biplab, Harshita. We didn't miss out any names.
No, sir, I didn't miss out.
Take interest, you should appreciate that as well. Yes, good, Aishwarya. Thank you.
I called out everyone's name, sir. Okay. So others who have been, not trying today, no problem. There are upcoming sessions. Keep watching them and come back and try out. It's nothing, very difficult or tedious like you think right now. It's going to be very easy. Wait for our upcoming sessions. Like I told, our next session is going to be on Friday, 6:30 p.m. So let's tune into that session and try answering. It's okay. Even if you go wrong, it's perfectly fine. That is how you learn. So we'll see you next day. Until then, it's a bye from the whole team of Dr. Polaris. A very good night to all of you.
Aishwarya, Harshita wants a topic.
Yeah, 1 minute, sir. Harshita, I'll get to you personally on this. Is that fine, dear? I'll share the whole schedule onto the group, actually. Yeah, Is it fine? Is it fine?
If I'm not mistaken, it is muscular system. But
yes, I am also thinking it's the same thing. Just a confirmation is required. It's actually the general anatomy of muscular system. Yeah. But let me just confirm it with the team. And I'll get back to you with the whole schedule, dear. Thank you so much. Come back for the next session too. Until then, bye.